Hello, you are tuned in to Notes on Unit 11 GI and Unit 12 Neuro with your host, Grant Mary. In this video we will be going over types of seizures, as well as Alzheimer's, and there will be 7 questions on the test. 7 for seizures and 4 for Alzheimer's, so this will potentially go over 11 questions that will be on the test. I don't know. Let's do it. Let's dive in. Alright, so Unit 12, Neuro. So this starts on page 774 to 776 with seizures. A seizure is a sudden, abnormal, disorderly discharge of neurons with transient alterations in brain functions. A seizure can present as a temporary disruption of the senses or a loss of consciousness with muscle spasms or repetitive convulsion. The common causes of seizures include epilepsy, degenerative brain disorders such as Alzheimer's, head trauma, metabolic disturbances such as hypoglycemia, hyponatremia, or respiratory alkalosis. So head trauma is the most common cause of epilepsy in the young, whereas stroke is the most common cause of epilepsy in the old. Head trauma is severe, penetrating. It can be sustained during a car accident or other traumatic injuries called epilepsy. Medical disorders such as dementia, which is the leading cause in the old, and disorders such as stroke and heart attack can also cause epilepsy. About 20% of seizures in children are associated with cerebral palsy. There's often a delay of months to years between an initial CNS injury, such as head trauma, stroke, or infection, and the first seizure. So you really don't know what will bring it on, because it will be 2 years down the road that you finally have your first seizure. Alright, so this is important. We need to know the types of generalized seizures. An absent seizure, also known as a hitting mall seizure, is a sudden collapse of consciousness for 5 to 30 seconds. Tonic-clonic seizures, also known as grand mal seizures, the patient commonly vocalizes loudly, can last for 5 minutes. Medical assistance is needed. If the seizure lasts for 30 minutes or happens in a series of 3 grand mal seizures, it is considered a medical emergency called epileptexis, and that is a classification for these people who have tonic-clonic or grand mal seizures, and we do need to know that for the test, so just put a pin in that. Be sure to know that. Let's see, epilepticus. So there was not only a seizure, but a epic seizure, and that's what caused them to be classified as epilepticus. Epic tonic-clonic seizure. So clonic seizures are rhythmic jerking movement of the arms and legs. Patient falls but is conscious, is usually preserved. The consciousness is usually, they are still awake, most likely. Tonic seizures are 20 to 30 seconds time period where the patient has stiffening of muscle movement. So tonic, still, clonic movement. Tonic-clonic, grand mal. So this plus this equals this. And then there's atonic, which is atonic seizure. The patient loses muscle tone for 15 seconds. The patient usually falls to the ground. Myoclonic is the final. Myoclonic seizures are brief, shock-like jerks of muscle, rapid alternating contractions and relaxations of muscle. They can be singularized. So type of seizures include simple versus complex. And simple involves one hemisphere and the patient does not lose consciousness. So let's see really quick which are are simple. So a clonic seizure would be simple. A myoclonic may be complex. A tonic-clonic seizure is definitely complex, and a absence seizure is also complex. So I guess the main one that wouldn't be complex would be just a singular clonic seizure. So before seizure, a patient may experience auras, which is a change in light or an unpleasant smell. They may be like, oh man, these schnozberries don't smell like schnozberries. And then you're like, oh, they're about to have a seizure. What do I do? Stop, listen, help to prevent injury. Don't put your finger or a wallet in the mouth, because they might gnaw it off because they don't have control of their jaw at the moment of the seizure. So what you want to do is lower them to the ground, and they may have altered level of consciousness for 5 to 30 minutes, but can last longer with your tonic-clonic seizures or your grand mals, the more severe. Lab studies to rule out substance abuse or physiological illness of the cause of seizure include CBC, serum chemistry, brain imaging such as MRI, CT, and fever. Brain imaging such as MRI and CT are helpful for head trauma. So, physiological illness, CBC, MRI, CT for head trauma. All right. Now, dementia. Dementia is a decline of reasoning, memory, judgment, or other cognitive functions. You will find dementia and Alzheimer's, which you need to know for the test, on 845 to 848. Dementia affects 30 to 50% of people older than 85 years old. Alzheimer's disease is a progressive neurological degenerative disease of the brain. It is characterized by significant changes in brain tissue. So, as you all know, it can come with a memory loss. As my parents say, they have some timers, not all timers, because memory loss is a common sign, but they don't have memory loss all the time, which is kind of alarming, but it's a joke, and I just play it off as a joke. So it's typically short-term to long-term memory, so you'll first forget like what you ate that morning instead of like forgetting your name or forgetting how to dress, because you learned that a long time ago. It's the short memory, things on the day-to-day that become difficult. And that's called apraxia, which is loss of short-term first. Apraxia is difficulty in performing tasks. Agnosia, which is forgetting the purpose of familiar items. Apathy, or not giving a Fruit Loop sandwich. Sundowning, not to be confused with the sundial. That's what I thought it would be associated with. I mean, obviously, it's, sundowning, sundial, like that tells time. Everybody knows that. But no, it's disorientation, and it's like you're disoriented during later in the evening, and you're more alert at the day, but when you get tired and function, or lose memory. So diagnosed by lab tests and neuroimaging, MRIs, decreased hippocampus, PET scanning, deposition of beta amyloidoids can be found in the brain, genetic testing, check for ApoE gene on the 19th chromosome. Treatments includes meds, OFC, this is pathopharmacology, right? So antipsychotics, if they have unbearable, like social function, I guess. Mood stabilizers, same. Serotonergic drugs, same. If they're depressed, apathetic, they need more serotonin. And stimulants to get them going, but also reality orienting is a way to bring patients back to the common time through events. Most common, like, oh, Christmas is coming up, Easter, or like Hanukkah, or Ramadan, or, you know, holy days, or big events coming up, like Turkey Day. Turkey Day is the most holiest of days of all. Bless that sacred meat. So validation therapy is developed by the Foxy Naomi Vail, and it's enabling the patient to give their time frame in working with that. So it's not so much as, you know, accepting that they are, you know, not thinking right. It's letting them live out their fantasy. Like they could be withholding how they feel. They could be withholding their perception of modern day because of the fact that it hurts too much. So Naomi Thiel said, well, if they think they're living in the 70s, let them eat cake. Except, you know, in a nice way, not in a tennis court trials, like, I don't know what the peasants are feeling kind of way. But that's all I got. And thank you for watching. And if you liked it, comment. If you didn't like it, comment as well. Feel free to like make fun of my facial hair or whatever. Thank you. Have a nice day.